Hi, everybody. It's time to I start. I wait 10 minutes for your friends, but now I start the class, okay? Yasser Ammar, Muhammad, Abdul Mohsen, Yaqin Muhammad, Sabah Jawahiri, okay?
Okay, doctor.
Thank you very much. Okay, you see the slides and cursor. Yes?
Yes, doctor.
Okay. Again, in the name of God, I start the class. Today we study the thoracic parts 1, the anatomy of the bony thorax. In the before session, many of the students ask me that this is not for a skeletal system or cardiovascular system. Not problems. This is a cardiovascular systems parts. You know, for studying of the cardiovascular systems, we need to learn the supporting tissue of the support these vital organs in our body. Okay, first I speak about the bone from work or thoracic cage of the body. This is thoracic cage. The thoracic cage is formed by the ribs and cartilage, their cartilage, the ribs, this is a costal or ribs. Both of them is true. And cartilage, this is a cartilage. And sternum, this is a sternum that located in the anterior side, and vertebral column that located in the column in the posterior view. Sternum, vertebra, and ribs and cartilage, their cartilage. These form the thoracic cage that support the heart tissue in the inside of its. The thoracic cage has one inlet. Inlet is here, and one outlet. Inlet connect the neck with the thoracic cage, and outlet connect the thoracic cage with the abdomen cavity. So thoracic opening or inlet is two inlets and outlets. Okay, in this slide, you see also the thoracic cage from the anterior view, from the posterior view. I numbered again sternum, ribs, and vertebral columns. These scapula and clavicle will study or taught in the skeletal systems. Okay, first I start the vertebral columns. This is the vertebral column. Vertebral columns, okay, is divided to four parts, to four sections: cervical parts, thoracic parts, and the lumbar parts and sacral parts. In the cervical parts, we have seven vertebral bones here. In the lumbar parts, we have 5 lumbar bones. In the thoracic parts, we have 12, and in the sacral, we have 5 bones. The cervical bones shows by the C1, C2, C7. By C refers to the cervical. The thoracic show by the T abbreviation. T refers to the thoracic. T1 to T12. L refers to the lumbar. L1 to L5 refers to the lumbar vertebral bones. And sacral showed up by the S. S1 to S5. Okay, you see the rib classification, yes?
Yes, doctor.
Thank you very much. Thank you. Okay. For studying of any things, we need to classify them. Like ribs, vertebral, and other upper limbs, lower limbs. We need to classify it for better learning and for better understanding, better finding of the things. Okay, ribs classification. The ribs classification happened by two forms, according to the true, false, or floating. And on another way for classification is according to the typical and atypical. Typical, typical here, and atypical. So according to the joint, or according to the true or false, the upper 7 pairs of ribs are called true ribs. The lower, this 5 is not true, it's a 3. It's a 3. The lower 3 pairs are false ribs, that including 8, 9, and 10. The 8, 9, and 10 vertebral, ribs, 8, 9, 10 ribs are false ribs. And lower 2 pairs are floatings, including 11 and 12. 11 and 12 ribs are floatings. The ribs can be divided also according to their features. I told you, typical and atypical. I told you we classified ribs according to the joint, according to the shape. According to the shape, including typical and atypical. 7 pairs of the ribs are typical. I show you. Another 5 pairs are called atypical. A is against. Okay, in this slide you see the atypical ribs. This is the first ribs, this is second ribs. The upper 2 ribs, including first and second, and lower 3 ribs are the atypical ribs. Okay, this is the first ribs. The first ribs, this is a head, this is a neck, this is a tubercle. And here is the body. Here is the vertebral ends, here is external ends. Why we say vertebral external? Because this parts joined with the vertebral and this parts joined with the sternum bones. And this is the second bones, head, neck, and tubercle, and trunk or body and external ends. Look at here, the tubercle in the ribs are two form, are articular and non-articular. Articular tubercle are smooth like this, and non-articular is non-smooth, is irregular. In another important things about the first and second ribs is that this is a shortest bones in the cage. The first ones is the shortest, is the first rib is shortest, widest, and most curved. Look at here, the curve of this is more than the curve of the seconds. But what about the second? The second ribs is twice in the length as the first ones. The length of this is twice than ones. In other words, this is twice bigger than first ribs. Okay, another typical ribs is including 11 ribs has no neck and tubercle. This is 11 and this is 12. The 11 don't have a neck, don't have a neck, don't have a tubercle. This is don't have a neck, don't have a tubercle, also don't have an angle and groove. So the 12 and 11 are atypical. Why? Because the form of them is not neck and tubercle, and the 12 don't neck, tubercle, angle, and groove. In this slide, you see the atypical. All atypical ribs, except seconds, second ones have only a single face for their respective vertebral. The above figures in here it's show. For example, here is a face. This part of the bones is faced. Faced is the place that joint with each other. The joint surface of the bones is faced. Here is a faced. For example, face to face. In this single, because many of the people ask me what's the meaning of faced. Faced is this part, the joining part of the bones with each other. This part, for example, is the face of this articular face. This is the first rib, second rib, and 11 and other rib. For example, first, second, and third, and 8 vertebral, 8 ribs of the thoracic cage. And what about the component of the typical ribs? Each typical ribs has a head, is here head, and with 2 faces. In here, this is head, in this part is a face. Look at here, this is a face. Face of jointing. Jointing surface is face. And has a neck. Neck is here. After head, we have a neck. Has a tubercle. This is a tubercle. The tubercle including 2 parts. A smooth part and non-smooth part. Articular part, non-articular parts. Look at here, the face of articular tubercle is smooth, but the face of the non-articular tubercle is non-smooth. Here is the angle. And after angle, we have a shaft. Shaft is body. Shaft is body. And a groove. Groove is here. This is a groove. In the groove, we have a the name of the groove is subcostal groove. Costal or ribs is the same words. The subcostal groove or subcostal groove or here, sulcus. Sulcus or groove is the same things. Okay, what's the related anatomical elements of the first and second ribs? It's very important for you. The anterior scalene muscles, middle scalene muscles, and subclavian muscles, muscles of serratus anterior, posterior subscalene, and subclavian vessels and satellite ganglion are near relation with these bones. For example, any fracture in these bones may cause this damage to these items. Subclavian. Look at here. This is the above surface of the first ribs. Here, this depression is sulcus for the artery, subclavian artery and vessels. Vessels is artery and veins. Here is for the artery, and here is for the vein. Okay, function of the rib angle. Here is angle. Yes, here is angle. What's the function of the angle? Do you know it is a most posterior point of the rib? Most posterior point. A frontal plane passes from tube angle and tip of the spinal process. Bilateral ribs angle make a flat back surface. Rib angles are specific for human being. Please keep in your mind for the final exam. For example, in the final exam, I told you that the ribs belong which of the following being. You say this is found only in the human. Look at here. This part of the look at it. This is part of the vertebral is angle. I'm sorry. This part is the angle. Look at here. Angle is here. In this part, this here is angle, posterior parts. Okay, up after the ribs, we studied the sternum. This is the sternum. The sternum has monobrium. This part of the sternum is a monobrium. Has a body. This part of the sternum is body. And here is a xiphoid process. Xiphoid process, that is hyaline cartilage. The hyaline cartilage. The shape of the xiphoid process or these parts are different in humans. For example, in the somebody, this part is foramen. In the somebody don't have foramen. In somebody, this is the xiphoid process is divided to horn. In somebody is not divided to horn. This is different and is normal. Look at here, this is a monobrium and this is a sternum. This part of joint, monobrium sternal joint here. It's important. Why? Because here's named sternal angle, or Lewis angle. Sternal angle or Lewis angle. It's important. Why? This sternal angle used for finding of second ribs. In the clinic is important. The finding of the ribs or counting of the count of the ribs is important. Why? Because for surgery. So this angle is important. By this angle you can count the ribs. How? Because this angle located in a line side with the second ribs. Look at here. This is the angle, and this is the second ribs. When you find second ribs, you can easily count first, second, and others ribs. Okay, so this is a monobrioclavicular joints. Is important. Look at here, is a suprasternal notch. This is a, I told you, Lewis angle or sternal angle, and this is a xiphoid process. This part, suprasternal part located in alongside with the first, second vertebral bones. Second bones joint with second to the 7 ribs. Here located between the disc of the 4 and 5 vertebral columns, and here located alongside with the T9 or thoracic vertebral bones 9. Okay. Sternal angle is described in the previous slide. Transverse ridge at the monobrium sternal junction. It is important bony landmark in the surface anatomy. Landmark is very important in our body. The landmark used for the finding of the internal organs. It joins with the second costal cartilage I told you. Superior notch is at the level of the second thoracic vertebral. Sternal angle is at the level of the disc between the 4 and 5 vertebral. Xiphoid joint is at the level of the 9 thoracic vertebral. What's the cervical ribs? Do you know this is a vertebral of the neck? This is a transverse process of this vertebral. Which vertebral? Cervical vertebral. The transverse process of the seven cervical vertebral in the sometimes may be enlarged or may be increased in size, and like this, the size of this transverse process is more than others transverse process. These form the cervical ribs that arise from the transverse process. In 0.5% of people, this is maybe occur. These cervical ribs cause the pressure on the lower trunk of the brachial plexus, and in back, this may cause pressure on the subclavian artery also. The humans that has cervical ribs may suffer from the upper limbs nerve and vessels damage. Okay, related anatomical elements of the first and second ribs. I told you anterior scalene, middle scalene, subclavian, serratus. These red and yellow these red and blue colors show the insertion and origin of these muscles. I told you, or I taught these slides in the first slides. Okay, the vertebral bones are like the ribs divided according to the pattern to the atypical and typical form. Atypical and typical form. What's the atypical vertebral? The first thoracic vertebral has the first and second and 9 and 10 and 11 vertebral called atypical vertebral. For example, in the final exam, I ask you that which of the following vertebral is atypical. The first, second, 9, 10, and 11 are the atypical vertebral. Why we say atypical vertebral? Because the face, articular face of these bones are complex, and the vertebral, non-vertebral, it has usually just one dominant face for the 9 ribs. 10 and 11 and 12 vertebral are also atypical. Why? Because they have one face on each side of their bodies. 11 and 12 vertebral bones is atypical. Why? Because they don't have face on their transverse process. Look at this slide is very important. This slide try show you that why we say typical and atypical. For example, the first rib joint with the first vertebral, so it's atypical. Second ribs joint with the second and first vertebral. Look at here, the ribs with two vertebral. The third ribs joint with the 3 and 2 vertebral. Fourth ribs joint with the 4 and third vertebral. 5 ribs joint with the 5 and 5. This is important. For example, 10 and 11 and 12 ribs joint with the same number of vertebral. For example, 10 vertebral with the 10 ribs. 10 ribs, 11 ribs with the 11 vertebral. 12 with the 12 vertebral. Look at here, this figure shows you the curvature of the vertebral column. We have two kinds of the curvature, primary and secondary. The curvature of the neck and the lumbar is secondary. The thoracic curvature and sacral curvature is primary. Why we see secondary and primary? Because during infant only we have a thoracic and cervical. I'm sorry, thoracic and sacral curvature. When a baby try to walk or get ahead in the above, this curvature is induced. For example, during a walking, the curvature of lumbar produce, and during a head getting of head in the above, this cervical curvature happens. So we say this curvature and this curvature happen after birth, but this curvature, thoracic ones and sacral ones, happens before birth. I'm so sorry, I disconnected.
No problem, doctor. You are sick, you should take vacation.
Hi, everybody. I'm so sorry for disconnection. Hi,
Hi, doctor.
Osman.
Hi, doctor.
Thank you very much. I disconnected, yes?
What, doctor?
I disconnected, yes? You see this?
Yes, yes,
slide?
doctor. No, I don't
Which
see. You
slide?
should share it.
Which slide were taught? I'm so sorry.
We
I
don't
can tell
see
you.
we don't see anything, doctor. We should share it first, and after that we see.
No, you know. Uh, which slide number slide? You can't
Maybe
view now.
23, 23, 24. I don't remember.
Oh, 23.
Maybe.
Yes, it's your right. Okay. The cervical rib. You see the cervical rib?
Until now, you don't share it, doctor.
Okay. Please, every time you speak that because I am on slides and I don't see you in the room.
Yes, doctor.
Thank you very much.
You are a sick, doctor. You should take a vacation.
Yes, I'm so sick. Yes, thank you very much. Okay, you see the slide, yes?
Yes, doctor.
Is the slide studied? Is the slide
Yes,
studied or
doctor.
no?
Yes,
Yes?
yeah. Yes, doctor.
Yes, thank you very much.
Next. And here, maybe we still.
Oh, here, yes.
26. Yes.
Yeah, but 26, thank you very much. This, yes?
No, before, doctor.
Yes,
Here.
this. Yes, thank you very much.
You are.
It's a good news because I think that I lost all of them. Thank you very much. I start the vertebral columns. Do you know each vertebral has one body, one pedicle, body, pedicle. This pedicle come from the body. Two transverse processes, right and left. Has a lamina, it's a lamina. And two lamina form the arc, vertebral arc. Vertebral arc, pedicle, body, and this is the spine. This is a transverse process. Look at these parts. This part is superior and inferior articular surface. Superior and inferior articular surface. In the body, in the lateral side of the your body, you see the face. This face is for the rib bones, rib bones. This is the superior face, this is the lateral face, this is the transverse face. This here for the vertebral, but this face is for the ribs. This face is for the upper and lower vertebral. Each vertebral also has a foramen. This foramen is the place of vertebral columns. This is a foramen, vertebral foramen. This foramen is placed for the spinal cord for the nerve system. So this body, this is a pedicle. This here, look at here, this is a notch, supra and infravertebral notch, located in the superior and inferior part of the pedicle. This is a bigger, it is a lateral view of the vertebral. For example, this is a body, here is a pedicle, here is a superior and inferior articular process. This is a transverse process, and this is a spine of the vertebral bones. Here is a face, here is a face, here is a face. This three face is for the rib bones. So we have 6 face for the ribs and 4 face for the vertebral joint. This is from above. This is a ribs located like this, joint like this. Lamina, arc, pedicle, body, transverse, and spinal process. Okay, thoracic vertebral. Typical. What's the typical vertebral? Which vertebral of thoracic is typical? The typical vertebral has a joint with the other vertebrals with 4 articular surface. I told you 1, 2, 3, 4. This is for the other vertebral, and has a 6 articular surface with the ribs. For example, 1, 2, 3. This 3 is for the costal or rib joint. Atypical vertebrals is first 10 and 11 and 12. It's important for the final exam. First and 10 and 11 and 12 vertebral are atypical vertebral. For example, in the final exam, I ask you that which of the following vertebral bones is atypical? You say 1, 10, 11, and 12. This kind of the dividing or of the bones is according to the pattern. Okay, question. Please tell me which vertebral has got just one face on the each side of the body. Which of them is true?
12 and 11.
All of them.
All of them?
Yes.
Uh-huh.
Yes, it's a good,
Yeah, you're
very
right
good.
in
You are,
that.
yes. Do you know, I give any patient that can't has a be active in the class, I give 1 extra mark on the final exam. Interactive classes, I like the interactive class. Okay, what about the questions 2?
Thank you.
The classification 7 and 5 are applied to. We divide which of them we classified according to the 7 and 5. It's a rib. For example, I'm sorry, the thoracic vertebral, because the ribs divided according to 7, 3, and 2. The thoracic vertebral divided according to the 7 and 5. Why? This 7 is typical vertebral and 5 is atypical vertebral bones. Okay. Look at this figure. This is important. This is a vertebral. This is a vertebral body. The vertebral body connect with each other by disc. This disc is shown in this figure, shown by the blue colors. These are blue colors. Here is anterior and here is posterior. The posterior part of the disc is very, very prone to damage or tearing or injury. Why? Because this is a thinner than these anterior ones. This here is a thicker than posterior parts. Here is the intervertebral foramen, superior notch and inferior notch of the vertebral form the intervertebral foramen. This is important. Why? Because the spinal nerve leave the spinal cord by this foramen. Here, look at these foramens. These foramens, all of these foramens is intervertebral foramens. Okay, do you know movement of the vertebral columns is related to the phase of the articular process. For example, in the lumbar parts, the lumbar articular process are oriented in the sagittal plane. In the thoracic parts, the thoracic articular process are oriented or directed in the frontal plane. In the cervical articular process, cervical regions, the cervical articular process oriented in the oblique plane. For these reasons, for example, you can move your neck in the different direction, but in the thoracic cage, thoracic vertebral, you can't move it easily. And in the lumbar, for example, you can move your lumbar in flexion and extension. You can't rotate it. This depending to this process, this articular process here. This cursor or this pointer refer to this face, articular face. This is play a main role in the movement of the vertebral columns. Okay, what is the intervertebral disc? Intervertebral disc, for example, in this, here is the intervertebral disc, okay? In this, we have two kind problems in the intervertebral disc. One of them is degeneration like this, and others is narrowing or spinal stenosis. Spinal stenosis and disc degeneration are common or are frequently happen in all vertebral columns. Look at here. This is an intervertebral disc. Here is an anterior part. Here is the posterior parts. Each intervertebral disc is formed from the annulus fibrosus. Annulus fibrosus. In other words, this part is formed by the fibers, collagen fibers, and nucleus pulposus. This part is not formed by the fibers, but also is formed by the grand substantia. For example, glycoprotein and glycosaminoglycan and other things. Look at here, this part of annulus is bigger than this part of annulus. So many damage or hernia happen in this part, in the posterior parts of disc. Please keep in your mind, are you hearing me or no? I disconnected. Are you hearing me?
Yes, doctor, we hear you.
Thank you. For example, any hernia happen in here. Please keep in your mind in the final exam, for example, I ask you the origin of the intervertebral disc is, you'll say that notochord. Notochord is the origin of the intervertebral disc. It's very important for final exam. Look at this man. This man has a problem in these parts. Why? Because this part of annulus fibrosus damaged and caused that nucleus pulposus enter to the vertebral columns and push the nerve systems in here. Push this spinal cord and cause stenosis. This cause stenosis in here. This kind of problems is a herniated lumbar disc. Look at this figure. This is the anterior view of the neck columns, and this is, for example, lateral view. in the anterior, this is a this is a spinal vertebral, and this is the body, and this part is the lateral view parts. Look at here in this shape, you see the this is a spinal process. In the lateral view, you see, for example, a problems, for example, in this part of maybe in these parts. Okay, this is a vertebral of the cervical regions, and this part, these dark line colors, is refers to the intervertebral disc. Any problems in this part called the herniated lumbar or disc problems, intervertebral disc problems. Okay, are there any questions about these slides? Are you see me? Are you see the slides?
Yes, doctor.
Thank
Yes,
you.
doctor.
Thank you very much. Okay, this slides is finished. If you have questions, yes, I'm sorry. I'm so sorry for disconnect. If you have questions, Osma, Yahya, and others, please, Muhammad Abdul Hassan and Yasser, Ammar.
I don't have a question. Maybe other student.
Thank you very much.
Doctor, I have a question.
Yes, but please listen to me. If you ask question, 5 question, I give you one more points or score in the final exam. I help you
Yeah.
in the final exam.
My question is, can you send the lecture to present
Yes,
it?
yes. Now I lecture. Well, please, Osma, please tell me spell your email to me.
I sent you message, doctor, but I not the
Yes, but
representative.
no. Please tell me your email, spelling of your email.
No, I sent you now in the
No,
messenger.
tell me, because I know I send you. Tell me what's the
Oh,
email.
yeah. OSAMAH
OSA, please. OSA Osma
MAH.
MA. Please.
I repeat it. OSAMAHDHA.
Osma. Yes.
Yes, Osama DHA.
Okay, Osama. I
Osama
don't
bin
have your.
Laden, you
I don't
should
have
not
your email.
forget me.
Yes,
I sent you, doctor.
yes. Send me, because I don't have your email.
Now I
Okay.
repeat, I sent it again.
Yeah. Thank you very much. Please send it me, and I reply the slides PDF files to you.
I sent it now in the message, doctor.
Thank you. Please be on the Osma Yahya, dear Osma Yahya. How are you, dear Ismail? I like you very much.
Thank you, doctor. Fast food
You are very, very
wellness,
good.
inshallah. No,
Thank you. You are very, very good. I hear more about you. You are very good. All of
thank
you
you,
are
doctor.
good. You know, all of you are good. I like
Yeah, all the
you.
students. Yeah.
Like you. Okay.
Thank you very much.
It's a download. Thank you. Please wait a minute. Only 1 minute.
All the time.
In our country, one of the problem is the low speed of internet. Because when during of presentation of our slides, I am on slides and I am not in room chat. So I can see that I connected or disconnected.
A problem in the VPN, doctor.
Yes, all of them. Thank you. This time is good time for you. Yes.
Yes, inshallah.
Doctor,
Yes. Sorry.
we should depend on Snail to study.
Yes, snail. The snail is very good. Do you know? My class is cardiovascular systems.
Yes.
In the SNL, the book described the thorax. In
Yes,
the
the thorax
only
part
yes,
1 and thoracic part 2.
only the cardiovascular related structure is important. For example, the bones and muscles and heart tissue is important, not lung tissue.
Okay, doctor. We
Lung
shouldn't
tissue.
study on gray, right?
Yes.
Okay.
And
Thank
also
you so much.
I sent the PDF of all slides to you. For example, now I sent to the Osma, dear Osma Yahya. Please check your email, Osma. I send it now.
Okay, doctor. Thank you so much for
Thank you
sending
very
it.
much, Sarah. Please be interactive in our class. If you ask more questions in the class, I help you in the final exam.
Okay, doctor. I already like the
Thank
anatomy,
you.
so I
Okay,
hope that.
thank Osma. Are you got it or no? Get it or no?
Yes, doctor, it arrived.
Okay, I send you. Thank you very much. Okay, goodbye, good morning, good night,
Thank-
goodbye, goodbye.
Goodbye, doctor. Fast wellness, inshallah.
Inshallah.